Hi, Vicky from Central Texas chapter. How are you this morning?
I'm good. How are you?
Well, good. I'm always glad to see you.
Same
now,
here.
now, you started your chapter 6 years ago in honor of your sweet, precious little girl right behind you, Jade. So tell me a little bit about her.
Jade was 4 when she was diagnosed with DIPG. She's just a bright, brilliant little girl. We love her and miss her tremendously. Just a normal little girl who loved, like you have one, right? You have two actually, but you have a little one, Blair, who loves princesses and dresses and parties and birthdays, and it's all about them at that age. And she was absolutely perfect. I mean, we love our children, and Jade was my first and my everything. She made me mother, and so being
And
diagnosed at
very
4 years old,
smart.
very
She liked
smart.
to do, you taught her sign language, which I'm still amazed.
Yes, yeah, she actually signed a lot. It was really important for me to communicate with her somehow, so we did a lot of sign language from when she was 6 months old on, and that's how we were able to communicate. It was wonderful.
Well, tell me how you knew something was wrong and how Jade was diagnosed.
I actually never knew anything was wrong with Jay. She didn't have any symptoms. As you look back now and think about all the times you spent with your child and wonder what you missed along the ways, all the signs. I
Mhm.
might have said the only thing I could even think about was maybe she was a little bit more tired than normal and slept a lot. But as a working parent too, when you come home, you're just thinking your child needed a nap or napped a little bit longer. But her diagnosis happened so quickly. Jade, we were on vacation and she slipped and fell, and that evening her eyes crossed, and that was the first sign that we've ever seen of any sort. And then that was 2 weeks before her diagnosis rapidly happened, and within 5 days she passed away from DIPG. And so really the symptoms rapidly progressed every single day from the day her eyes crossed. But prior to that, we would have known that there was anything wrong with her at all.
And so, why did you take her to the doctor when she was diagnosed?
Well, I took her because her eyes crossed and went
Okay.
uncrossed. So we just assumed, okay, take her to an optometrist or ophthalmologist, and maybe she just needs glasses. But as you working in a hospital, as an administrator at that point in time, I worked with so many physicians and nurses who said, this doesn't sound right. Kids don't cross their eyes from a fall. It's got to be more than that. So you need to take her in. And that's when we started with the MRI, the CT scan, all the specialists that you can have out there, from neurologists to pediatricians, ophthalmologists, optometrists, to find out that she had DIPG.
Well, and it was so quick. It was only 5 days, and I mean, any family, this is life altering. And but y'all got pretty connected with the Cure Starts Now right away. Like, why has it been important to you to get involved with the Cure Starts Now and start a chapter?
Well, as you look into childhood cancer, you realize, especially someone who's been in healthcare for so long and have never really heard about all the childhood cancer underfunding um, and advocacy out there, you have to do something. How could you not? I
Right.
mean, these are our kids. And if we don't do it, who will? So it was actually Jade who guided me to the Cure Stars Now, but I was actively searching for an organization, a foundation that was as passionate as I was, that focused on primarily DIPG, but all brain tumors predominantly, and that, is willing to battle this disease that nobody is willing to take on. It's a monster beyond what we know, Melissa. We face that every single day. But to hear
Yes.
from researchers and to hear from other healthcare foundations and healthcare organizations that said, you know what, we don't touch DIPG because it's fatal. There's no point. And there has to be a time when we all stand up and say, you know what, DIPG is as important as any other cancer out there, or more important. And we see,
More.
yes, and we see those strains in every other cancer out there. We have to do something. So that's why we fight so hard. And that's why we started our chapter, was not only in honor of Jade and carrying on her legacy, but really funding that type of research.
Well, I'm glad you have, because you're my partner in crime and we have a lot of fun while raising money. So I thank you, and I'm glad you're on my team.
I am too.
Glad you're my friend.
I know we work well together, definitely.
Thank you, Vicky.
Thanks.